Hello everyone, this is Dr. Drake with levelupshoulder.com, and today we're going to discuss shoulder arthritis and the differences between a standard shoulder replacement and a reverse total shoulder replacement. I'll bring up the model. We'll talk about the articular cartilage of the shoulder, which is represented in blue. That's present both on the ball and socket side. When you develop arthritis, you get irregularity of the articular cartilage, which causes pain. And then oftentimes you'll get a bone spur that wraps from the front to the back of the shoulder, which also creates a mechanical blockade to motion. So you have pain and loss of motion with arthritis of the shoulder. The rotator cuff is important to the shoulder in that it creates compression of the ball to the socket with shoulder motion. So as the shoulder elevates using the big muscle out here called the deltoid, the rotator cuff puts the ball, centers it on the socket to allow elevation. When you have a rotator cuff tear, sometimes there's superior migration or translation of the ball on the socket. So when you rotate, the deltoid shortens and the ball, instead of rotating here, translates up and hits this bone and can cause discomfort. So when you're deciding between a standard shoulder replacement and a reverse shoulder replacement, the rotator cuff is important. The weakest link of the shoulder replacement is always the socket. There's very little bone on the socket when compared to the proximal humerus. So if I pull up an implant that demonstrates a standard shoulder replacement and we look at the socket, it's a highly specialized piece of plastic that gets cemented into position onto the socket. And this is a lifelike representation, and you can see the socket is very small when compared to the ball. So both surfaces are replaced. However, if the rotator cuff is missing and this translates up instead of rotating equally, you get edge loading of the socket, and that can loosen over time, creating premature failure. So that is an instance when a reverse total shoulder would be required. So the reverse is that we put the ball on the socket side and the socket on the ball side. And why do we do that? Well, we do that because we need the fulcrum to be recreated. When the deltoid gets under tension, we need rotation, not translation. So in this instance, there's a bit of a marriage between the socket and the ball, which recreates the fulcrum and gives us a functional shoulder, and the socket will not loosen. So that's the main difference. If your rotator cuff is working well, you can get by with a standard shoulder replacement. However, if you have a torn rotator cuff, a standard shoulder replacement will fail prematurely, and that's why one would need a reverse. I hope that helps. Have a wonderful day. Take care.